Hi, everyone. Thanks so much for attending our webinar today, How to Conduct a Thorough, Patient-Focused Health Assessment Every Time. We are very excited that you took the time to join us today. My name is Jackie White. I am the Marketing Manager for our assessment list at F.A. Davis Company, and I'm also joined with Lisa Hauk, who is the publisher. Before we get started, I just want to cover some housekeeping items. So to ensure that everybody has the best audio quality today, we do have all of our attendees on mute, but we want to keep it active. We want to hear from you. So if you have questions during the presentation, if you have comments, please feel free to submit them in the Q&A box, and you can find that at the bottom right-hand corner of your screen. Also, we'll have a survey that pops up at the end of the webinar. Please take 2 minutes, fill it out, because we want to make sure that we're able to get you a complimentary copy of our textbook. We want to make sure that we can get you the online resources so that you can access some of the instructor and student resources that come with the product. And we also want to make sure that you have questions that come up after the webinar that we can reach out to you and make sure that you can have some help getting started. So let's jump into our presentation. I'm going to start with the agenda. And I did mention that we want to keep it interactive. So how about, to kick it off, if everybody writes their biggest challenge with their students in teaching assessment. So I'll give everybody a minute, all the attendees out there, if you could fill in your answer in the Q&A box. What is the biggest challenge that you have with your students in teaching assessment? And I'll get to some of those challenges in a little bit, but I'm sure that Lisa and I will keep those in mind, especially as we're walking through our new product. So what are we going to be talking about today? We're going to start with the approach and an overview. I'm going to jump in and have Lisa walk us through a chapter organization, and you're really going to see the consistency in the framework. We'll also do a walkthrough of all the great features and how they can benefit you and your students. We'll talk about some of the great online resources that most of you are probably familiar with. Davis Plus, that is our website of all of our instructor and student resources. And we'll also take questions, so make sure that you're filling that out as well. Health assessment is one of the core courses and skills that nurses will need throughout their nursing career. We all know it's the foundation of safely caring for patients across the lifespan. And you know better than anyone that your students are going to need a concise, easy-to-follow guide that provides essential coverage of a routine, head-to-toe focused or comprehensive health assessment. And that is exactly why we developed Essential Health Assessment by Janice Thompson. It is definitely a new generation core textbook for today's learner, or it could also be used as a great reference guide for a practicing nurse. So I'm sure that we have instructors from different programs and what you might be looking for. So keep that in mind while we show you some of the chapter and some of the features. Because, I mean, students, whether they're in the classroom or clinical or even in the real world, they must identify normal from abnormal findings. And they have to recognize when a finding is outside that spectrum of normal. So brings us right back to the question, how do students conduct a thorough, patient-focused health assessment every time? And that is through our book. And what will it do to make them successful? It's because it concentrates on essential need-to-know information and techniques, and it excludes the non-essential information that does not need to be emphasized for health assessment. The focus is really on typical findings, and abnormal findings are limited to those most commonly seen in clinical practice. So when you review your complimentary copy once it arrives, or even as we walk through a sample chapter today, really think about what you're seeing. We definitely include a comprehensive review of the systems and assessment techniques in the printed text and also the ebook, as well as documentation information and other great resources online. So it helps the students really put everything about assessment together, which is so important. And to make sure that we covered health assessment across the lifespan, this book includes specialty chapters focusing on the newborn, pediatric, pregnant woman, and older adult populations. So when Lisa walks through the chapter, you're going to see it presented very clear. The techniques are going to be in full color. They're going to be step-by-step, including illustrations and photos to ensure your students are confident and successful conducting a health assessment. So at this time, I'm going to turn it over to Lisa, and I do want to at least see if any challenges came in, because the challenges are really important because that was our goal in really creating this text as well. So some of the challenges we have, Brenda, how to teach students to be comprehensive yet concise. That's a great one. We have Beverly, remembering landmarks and feeling overwhelmed with all the details. Another good one, Lisa, to remember as we're covering some of the sample chapter and walking through the text. Sherry, the greatest challenge is to instill patience in students wanting to learn everything at one time. Teaching normal first, especially early on in the curriculum. Great one, Sherry. I'm sure that a lot of other attendees can relate to what your challenge is. We've heard that one a lot. Jacqueline, courses taught online, so difficult to teach such a hands-on topic online. All right, so we have great challenges coming in. I'm not able to get to all of them, but we'll keep these in mind, keep submitting them, and think about some of those challenges as we walk through the product. So I'm going to now pull up Davis Plus so that we can dive into Essential Health Assessment and see some of the features and layout that I've been talking about. So as I pulled Davis Plus up, Lisa, are you on the line?
I am.
Okay, great. I'll pull up the ebook.
All right, while you do that, Jackie, I want to first introduce myself. Hello, my name is Lisa Hauk. I am responsible for the assessment publishing for F.A. Davis, and I am delighted to be able to walk you through one of the chapters in the new Essential Health Assessment by Janice Thompson. Janice is a faculty member at Quinnipiac University. She's had many years of teaching physical assessment, and she has distilled those many years of experience into what we hope will be a very concise, easy to use, easy to follow guide to health assessment for students. I was interested, I was reading through the greatest challenges that you were adding as Jackie was doing her introduction, and I was very interested. Some of these things, some of the challenges you face are not things that a book can do much about for you. In other words, you're teaching this course online. Well, okay, that's a special challenge in itself. It's hard keeping students' attention. That also is a challenge, but something I think we might be able to help you with. And having enough hands-on time and space to actually practice stuff. Obviously, a book is not going to be able to do much about that, but what a book can do, and what this book does do, is present information in a consistent way so that you can teach your students to approach every patient the same way. Once they have developed a process, a technique that works for them, and the book actually presents this to them, once they have that under their belts and they use it every time, it becomes easier to use every time they use it. They are less likely to leave things out. They are more focused on the things that will be most important to them, and they will get the best result from their assessment. So we chose a chapter to walk you through that is fairly limited. I mean, we're going to do the ears, and it is sort of a really discrete topic area. It's not like, you know, the cardiac system or the respiratory system or something like that. But we wanted to show you this chapter so that we could illustrate how the organization works in your students' favor, how it supports your students' learning and their practice. So, as is true with every chapter, everything starts off with a brief introduction, but then it goes into a review of anatomy and physiology. And this is not an exhaustive review by any stretch of the imagination. This is meant to simply call to mind for the student the things that they are going to have to actually be aware of as they are moving through this particular system. So it hits the highlights. It has usually one, possibly two illustrations. It is really more of a way of reminding them of their A&P than it is to actually represent the A&P to them. Okay, and then we go to the health history. You want to start out with a health history, obviously, because you want all that foundational information. The medical history, the environment, the family history, whatever is going to impact that system, you want to have it right out in the open right then. And we focus students on the most critical aspects of the history in the book itself. You'll notice on the page that we use bullets a lot. We are trying to not overwhelm them with text. We are trying to make discrete nuggets of information that they can call to mind easily after they are no longer actually in the book. We are also trying to be very functionally oriented. So look at box 10.1. Do you need a hearing test? These are actionable items. These are questions that you can ask specifically to elicit the kind of information that you need to get. And that's the point of everything in this book. It is designed to elicit information that you can use as a healthcare professional, as a professional nurse, to establish the baseline. We all know that assessment is the foundation of nursing process and nursing care. Well, this book is the way to establish that foundation in the physical health, in the health assessment. So we go through the review of systems, we go through the medical history, we go through environmental questions, and you'll notice that sprinkled throughout the text we have tips. These tips relate to evidence-based practice guidelines, to governmental standards, to information that Janice has developed over her many years of teaching. So those tips are a long-time experienced clinician speaking to the student saying, look, this is important, keep this in mind. Then, again, because it is so important to be organized and to be consistent, we always talk about preparing for the assessment. What equipment do you need? Let's review the sequence of the assessment. Let's review the preliminary steps, and then we move into the focused assessment. And we break this down. We present the focused assessment as a series of techniques, and we are very careful to present them in a very linear format. Somebody said one of the greatest challenges, two people said, it's hard for students to keep the procedures and the steps in mind, and they become overwhelmed with detail. Well, what we are trying to do in this book is focus their attention to say, let's forget about extraneous stuff, just focus on this. This is the technique, this is the first step, the second step, the third step, and we are trying to as I said, focus their attention so that they don't get overwhelmed. Again, you'll see how the page is laid out. The steps of the procedure are on the left, and the illustrations for technique or orientation are on the right. You'll see also incorporated into the presentation of the technique safe and effective nursing care sections, the SENC, Safety Alert. That is not just a tip, but that is an important tip that says, look, if you see this, this is an issue that you have to deal with immediately. So the SENC sort of ups the level, sort of separates out for the student something that they really have to pay attention to. And that's why we do it in that colored type, so that they will really, it will jump out at them. Notice, too, that we separate normal and abnormal findings. Our goal is to focus on normal and normal variance. The idea is if you are able to identify normal and normal variance, anything that lies outside that is probably abnormal. But again, there are so many abnormals that are possible sometimes that students get overwhelmed. So what we want to do is focus their attention on normal and normal variance, and then mention abnormals just to make sure that they understand what the differences are, but we want to focus their attention on normal and normal variance. So we can continue just going through technique, technique, technique. You'll see tips integrated throughout. You'll see the safe and effective nursing care red type featured throughout. In the case there, when necessary, you will also see cultural considerations addressed. There don't happen to be any in the ear chapter, but every chapter ends with patient education focused on Healthy People 2020. And again, we bullet this list. We don't want to have students have to read through pages and pages of verbiage to get what they need. We are trying, the key word here is we're trying to get them to focus. We're trying to get them to see the linear steps of the core techniques, and then once they have that down and they can apply those over and over and over again, then they can start branching out and looking at more at broader issues and taking into account more abnormals. And that's really all I wanted to call to your attention today, other than the fact that the book is comprehensive, as Jackie pointed out. Life changes are addressed in separate chapters, and in each of the systems chapters, we refer to when there are changes in technique that are necessitated by life stage issues, then we let you know, and we will refer you to the life stage chapter. And I think that's all I have to say about the book itself. And Jackie, I'm going to turn it back to you.
Okay, great, Lisa. Thank you so much for that overview and walkthrough. It's great to get in and really see what we're talking about. And there, at least before we, I know some questions came in, so before we get to the questions, I do want to cover at least some of the online resources. I know this is what comes up when you're thinking about using a textbook in your classroom, what's available to you to save time, and what's available to your students in order to help them apply what they're learning or make the learning more interactive. And we have great resources for you and for your classroom. We have the Davis digital ebook available for not only instructors or their students. I mean, the book itself isn't that big, but at the same time, it's very easy to have the ebook available. So regardless of what format your students like to read in, they have that available as well. We have a test bag with over 750 questions. They're NCLEX style questions, and they also include the rationales and the descriptors, as well as page references where you can find the correct answers. There's PowerPoints for you. I also have listed that there's case studies. Instructors so many times like them to make the learning more active and be able to reinforce critical thinking and documentation. And we also have an essential health assessment practicum. And this is a comprehensive health assessment rubric for a 25-minute timed head-to-toe assessment. So this is something that the author has used and has used as a graded exercise. And it's something that you could use as maybe a graded exercise or at the end of the semester. So that's a fun instructor resource as well. And we didn't neglect the students. Like I said, we have the ebook. We also have advanced assessment techniques and audio library, which provides some samples and percussion sounds. There's also case studies available to them that they can use for an exercise in critical thinking and documentation. And each case study provides a potential like real life clinical scenario, and with those scenarios taking place, it's just a really good way for students to apply their knowledge. And we also have the procedure checklist. So another good way to review these resources is to get access, jump in, and take a look at what's available. So as you're reviewing your complimentary copy, we can also provide you access to Davis Plus to see what is available online. All right, so let's take a second and see if we've had any questions come in.
Jackie, while you do that, may I mention one more thing?
Absolutely.
We partner with EHR Tutor, which is a documentation and a web-based documentation product that would make a beautiful companion piece to the assessment book. You can create patient charts. You can use pre-populated patient charts in EHR Tutor itself, and it really affords a wonderful interactive way to support a student's participation in the health assessment course. So just wanted to bring that to your attention. It's called EHR Tutor. It is bundleable with the Essential Health Assessment, and if you're interested in something like that, your educational consultant can work out a very good discounted price for you.
All right, great. Thanks, Lisa. That was good to mention because we do hear overwhelmingly positive feedback from some of our instructors that are using EHR Tutor in the classroom, and have a lot of interest from other educators that haven't maybe heard about it yet or are interested in our new partnership. So Lisa, a question that did come in, and you might be able to answer this better than myself, but are there keywords highlighted so the student builds their knowledge base?
There are not keywords highlighted, well, I beg your pardon. There are keywords highlighted in the text itself, but what I would suggest is go to the audio library as well. Using the audio library in conjunction with the highlighted keywords in the text will allow your learners who like to hear their information as well as those who like to read it a chance to hear the word pronounced and learn how to pronounce it correctly, as well as seeing the words highlighted in the text. So yes, there are keywords highlighted in the text, but I think the audio library affords an extra dimension to that whole keyword approach.
Great. So another question that came in is if students can use their resources on different mobile devices, and they absolutely can, whether they have a smartphone or tablet. Most of our Davis Plus resources are available for them to use on those types of devices. So it's really good to access anytime or whether it's on the go. Okay, let me see. Lisa, another question that came in, is this book used in a master's program for physical health assessment advanced?
I would say no. I would say at a master's level, you're interested in a more advanced collection of techniques. We do have some sort of that bridge, sit on the divide, but for the most part, this book is designed for the undergraduate market.
Okay, thanks for clarifying. I saw that there was another question that came in more about the resources again, and if it has the capability to be downloaded so that into your students' learning management system, and that's absolutely something that you can do. So with our Davis Plus resources, especially for this title. And Lisa, another question that came in, which I think you might be able to answer, is if will this resource or this product, is there plans for it to potentially be linked to EHR Tutor case studies? I know that we do have that for some of our other products. Is this something that you might be thinking about with this product as well?
Actually, yes. We think that EHR Tutor is so robust that we are moving to make sure that a selection of patients in EHR Tutor are linked directly to each of our core textbooks. So yes, I hope to do that in the future. I cannot give you a date for when that will be accomplished, but I will tell you this. Assessment is a key component to almost every patient encounter. If you go into EHR Tutor and open any patient chart, you will see in the flow charts vital signs and health history and every aspect of the assessment that you're trying to teach. You could probably use almost any of those patient charts as a way to, as it were, bring an assessment into the classroom.
All right, great. And Lisa, another question that came in, could you see this product being used in a concept-based curriculum?
I don't see why not. That's an interesting question because again, when you are teaching conceptually, that does not preclude the assessment of the physical body. Well, I forgive my ignorance, but I cannot imagine how you would do a conceptual assessment. So whether it's a conceptual-based program or a traditionally organized program, your assessment, I believe, would remain the same. So yes, my reaction would be yes, you could.
Okay, great. And I'll take one more question before we close out, but I want to thank everybody again for calling in. And if you think of questions that we didn't get to today or after the presentation, you can either put it in the survey or reach out to us as well. I'll pull up some of our contact information. Another question that came in, is there a hard copy of the book available, and would students get Davis Plus resources? Yes, there is a hard copy of the book available. You can have your students either purchase the hard copy, which has a scratch-off code on the inside front cover, and that's how they would get access to the Davis Plus resources, or they could also purchase the Davis digital ebook version directly on Davis Plus and have access to the resources. So we do have the print or the ebook available on Davis Plus. So like I said earlier, if you have questions that we didn't get to, questions that you think of after the webinar, let us know in the survey or reach out to us at fadavisnursing@fadavis.com, or you could always visit our website. And if you're interested in a complimentary copy of Essential Health Assessment that we reviewed today, we'll be happy to get one out to you. Or if you would like access to look at the instructor and student online resources, we can make sure to get you that as well. So Lisa and I are here to help with any questions. Get this book in front of you and see if it's a good fit for you and your students. So thanks again
Jackie,
for joining us.
Okay, can I interrupt just for 1 second? To the instructor who asked the question about using the book in the conceptual-based program, I would really like to talk to you more about what challenges that might present. So if you could email me, and my email address, my company email address is LB as in boy, H as in Hauk, @fadavis.com. If you would identify yourself as the instructor who raised the issue about health assessment and conceptual-based nursing, I'd really like to talk to you. Thanks so much.
Yeah, thanks. So we can make sure that we connect you, Lisa, with that instructor. And for everybody else, I know a couple questions are even coming in about how do you get access to the book and the resources. Just want to mention it one more time. We're going to have a survey that pops up after the webinar. Fill that out. Let us know if you want access to the ebook. Let us know if you want access to the resources to review. We can make sure to get you set up for everything so that you can check what some other chapters and really what Essential Health Assessment is all about, and hopefully that it can meet your unique needs and make sure that you're successful in the classroom and that your students are successful with health assessment. So thanks again for joining us. Please reach out to us. We want to make sure to get you your copy. So thanks again, and thanks to Lisa for joining us for another successful webinar. Have a good one, guys.
Thanks, everybody.